When I started my career in infectious diseases, the HIV diagnosis was devastating news. Not just medically, but in every sense. The treatments had a lot of side effects, the prognosis was poor, and the stigma was enormous. A lot has changed since then. But here's what hasn't changed enough. There are around 5,000 people in the UK right now who are living with HIV and have absolutely no idea. They feel well, they look well, and some of them, without ever knowing it, are passing the virus on to people they care about. In this video, I want to give you a clear, honest picture of HIV, what it actually is, how it spreads, who's most at risk, what symptoms to look out for, and why getting tested early is so important. Because I've seen what happens when people find out too late. I've also seen what's possible when they don't. I'm Dr. Ravi Gowda, a consultant physician in infectious diseases, and I work with health clinics here in the UK. I've spent a significant part of my career diagnosing and treating HIV. So everything I'm about to tell you comes from real clinical experience, not just textbooks. Let's start with the basics. HIV stands for Human Immunodeficiency Virus. It attacks the immune system, specifically a type of white blood cell called CD4 T cells, which are essentially the generals of your body's defense army. As HIV gradually destroys these cells, the immune system becomes weaker and weaker. Eventually, if HIV is left completely untreated, the body can no longer fight off infections, and certain cancers that a healthy immune system would deal with without any trouble at all. That's the stage we call AIDS, Acquired Immune Deficiency Syndrome. There's a lot of confusion about HIV and AIDS. HIV is the virus. AIDS is what can develop after years of untreated HIV infection. If you like, the advanced stages of HIV. And with modern treatment, most people in the UK who are living with HIV today will never reach that stage of AIDS. Globally, about 40 million people are living with HIV. Here in the UK, that figure is approximately 105,000. And the good news is that 97% of those who have been diagnosed are on effective treatment. The challenge is reaching the people who haven't got there yet. The most common routes of transmission are unprotected sexual contact with anal intercourse carrying the highest risk. But things like sharing needles or injecting equipment and transmission from mother to baby during pregnancy, childbirth or breastfeeding also contribute. Blood transfusions were historically a significant rule, but in the UK, blood donations are screened fairly vigorously, and therefore your risk is quite low. What I really want to address is the sort of myths that go around with HIV, because in the 30 years of medicine, I've heard quite a few. But here's how you can't get HIV. You can't get HIV from hugging someone, from kissing or shaking hands, sharing food or cups, or from a swimming pool or coughing and sneezing. HIV is not an airborne disease. It cannot survive outside the body very long. So everyday social contact carries zero risk of transmission. Everyday social contact carries zero risk, none. The stigma that surrounds HIV, and it's still very real, is partly built on these misconceptions. HIV can affect anyone, but in the UK, certain groups carry a disproportionate burden. And it's important that those groups are aware, because knowing your risk is the first step to getting tested. Gay and bisexual men continue to be affected significantly. This is partly biological. The risk of transmission through anal intercourse is considerably higher than through other forms of sexual contact. The Black African communities are also disproportionately affected. This is often related to higher prevalence in their countries of origin, combined with the real barriers to accessing testing and healthcare here in the UK. People who share needles when injecting drugs remain at significant risk, and anyone who has unprotected sexual contact with multiple partners or whose partner status is unknown also carry an increased risk. If you fall into any of these groups, regular HIV testing is something I'd strongly encourage. But to be very clear, HIV doesn't discriminate. I've diagnosed HIV in every age group every background and every walk of life. Nobody is exempt from the need to know their status. So, the trouble with HIV is that many people have no symptoms at all, particularly in the early and the chronic silent stages. In the first few weeks after infection, some people experience what we call a seroconversion illness, or acute retroviral syndrome. It can very much feel like a bout of fever, fatigue, aches, swollen glands, a sore throat, and sometimes a rash. People put it down to a winter bug and think nothing more of it. After that initial phase, HIV can remain completely silent in some people for a decade or more. No symptoms, feeling perfectly well, they're going to work, getting on with their lives, and all the while the virus is quietly working away at their immune system. And it can also be still transmitted. I've seen patients come to us with tuberculosis, with pneumonia, severe oral thrush or shingles, and when we've investigated them, we found undiagnosed HIV. They had no idea. And in some cases, we're dealing with a CD4 count that had dropped dangerously low, and so low that significant damage had been building up silently for years. That's the reality of relying on symptoms. You simply don't know you've got HIV unless you get tested. Testing is where I want to spend a bit of time because it's genuinely the most important message in this video. Around 5,000 people in the UK are living with HIV without knowing it. According to the UK Health Security Agency, 42% of HIV diagnoses in this country are still made late, meaning the immune system has already sustained significant damage by the time we've found out. The only way to know your HIV status is to get tested. There's no other way. The testing is actually fairly straightforward. In the UK, we use a blood test called a fourth generation HIV test, which detects both the HIV antibodies and the P24 antigen, a protein produced by the virus. Testing for both means we can pick up the infection considerably earlier than older tests could. Most infections are detected by 45 days after exposure, but the fully definitive result at 90 days. You can get tested through your GP, on the NHS, at sexual health clinics, through home testing kits. But we also, here at health clinics, offer a fast, confidential HIV test with the results back within 1 to 3 working days. You can book directly through the link in the description. If you think you have HIV in the last 72 hours, please don't wait to get tested. There is emergency treatment called PEP, post-exposure prophylaxis, to prevent infection. But it has to be started as soon as possible within 72 hours. Go to your nearest A&E or sexual health clinic straight away. Secondly, if you're at sort of ongoing higher risk, ask your GP or sexual health clinic about PrEP, that's pre-exposure prophylaxis. It's now available free on the NHS, and when taken correctly, provides effective protection against HIV. The transformation in HIV treatment over the last 2 decades has been genuinely remarkable. And I say that as someone who's watched it happen. When I first started infectious diseases, antiretroviral treatment meant a complex regimen of multiple tablets with significant side effects. For most people, it's a single tablet taken once a day. It's well tolerated, it's highly effective, and life-changing. And the goal of treatment, known as antiretroviral therapy or ART, is to suppress that viral load to what we call undetectable levels. And when that's achieved, the immune system recovers, the person stays well, and this is the part that I think is still not widely known, that they cannot pass HIV on sexually if they're undetectable. And that's backed by solid evidence, including the landmark Partner 2 study published in The Lancet in 2019. It's also known as U equals U, undetectable equals untransmittable. I've had patients come in to me seriously unwell with cryptococcal meningitis, with pneumocystis pneumonia, with infections that were genuinely life-threatening, who with prompt treatment have made full recoveries and now lead completely normal lives. people who are diagnosed late are at far greater risk of serious complications, like some forms of cancers, severe infections, and neurological problems. They're harder to treat, and the data is stark. People diagnosed at a late stage are up to 10 times more likely to die within a year of diagnosis than those who were diagnosed early. So yes, HIV is manageable. Yes, treatment is excellent, but only if we know about it in time. And that's why diagnosis matters so much. And that's why testing saves lives. It really is that simple. HIV has gone from being one of the most feared diagnoses in medicine to a manageable long-term condition like diabetes. With the right treatment, started early, living with HIV can lead healthy and full lives. But none of that is possible without knowing your status. If you're worried, if you've had unprotected contact with a new partner, if it's simply been a while since you were tested, or you're not sure of your status, just go and get tested. It's fairly quick, it's fairly straightforward, and it makes a difference. At health clinics, we offer a confidential HIV test with results back in 1 to 3 working days. You can book your appointment through the link in the description. It just takes a couple of minutes. If this video has been useful, please do share it. Somebody in your life might really need to see it. And finally, like and subscribe for more straightforward, honest health information from health clinics. And thank you for listening.